PSA blood test is an early check for prostate cancer. This test came out in the 1980s. Before the PSA blood test came out, the first check that we had for prostate cancer was actually the finger check of the prostate, and that only detected cancer when it was already fairly advanced and it was a hard mass. And at that time, it was often too late to be able to cure a man. With the PSA blood test, we're able to detect an abnormality much earlier on. Men who are at increased risk for prostate cancer are men who have either a family history of prostate cancer or men of African American Caribbean descent. For those men, we recommend that they have a conversation with their family physician or their urologist starting at age 40 for when they want to have their first PSA test. In men who are not at increased risk, that is, they're not of African American Caribbean descent and they have no family history, we recommend screening to start, that is the first blood test, in between age 50 and 55 as a first test. Now, if that first test in the 40s in a man at increased risk or in the 50s at a man who's not at increased risk, if that blood test is initially very low and normal, that can be repeated every 1 to 2 years. In men whose blood test is elevated, it really depends on how elevated it is. If it's just a little bit elevated, we will often wait and repeat it several months later to see whether it's going to continue rising. But in men whose blood test is really high, we'll recommend a biopsy of the prostate to check further to see whether there is a cancer in the prostate.